Lameness is a very common problem in equine medicine. It can be anything from a shoulder to a knee to a foot, but 90% of lameness tends to be the foot in the horse. If horses become sore in their feet, it can actually cause them to be lame, and this can cause them to limp. So we actually refer to the limping as lameness. To start my exam, I generally jog the horse first and look for any differences in gait or pain that they might be feeling that they can't actually tell me about. When the horse is jogging, there are a lot of different ways to look at lameness, and one of the ways I look at lameness is that when the horse is jogging towards you, the affected leg often hits the ground and the head will go up. So you're looking for a head bob up when the affected leg hits the ground, and that's one easy way to tell you that the horse is actually lame. I also use a lot of palpation, which means that I like to actually put my hands on the different tendons and ligaments and feel for any heat or swelling or potential pain that they're feeling in each joint and each tendon and ligament as well. I really have to be a detective when I work up a lameness case because the horses can't tell you exactly what hurts. So you have to start with a systematic approach like palpations, and that way you can define pain for them, and then move into digital nerve blocks, which is basically numbing the nerves so that they're not limping anymore. To perform a nerve block, I begin by lifting up the leg, and it's very important to palpate the nerve to know its location. The veins and arteries and nerves run together below the ankle, and so by palpation, I know exactly where I should put the needle. I then inject the needle and then inject the numbing substance once the needle's in place. And then to confirm whether the block has actually worked or not and made the horse feel better, I actually walk and jog them again, and if no lameness is evident and their gait is normal, then you've found the problem. Once we've palpated all of the limbs, forelimbs and hind limbs, I'll often check the feet. Horses tend to get a lot of feet problems, and they can have abscesses or bruising. And to do this, I actually pick up the leg and use hoof testers to see if there is a sore spot anywhere on the horse's hoof. The advantage of using hoof testers is that they can help me pinpoint exactly where on the foot the horse is having a pain issue or where a bruise or an abscess may be located. So by squeezing the hoof testers on a specific area of the foot, I look for a response from my patient to see if they actually hurt, and that way I can look to see if there's a problem like a bruise or an abscess in that area. Lameness can be very rewarding because it's like solving a puzzle. The horse can't tell you exactly what's wrong or why they're limping, but through your lameness exam and potentially blocks and diagnostic techniques, you can actually help them feel better and perform again at their highest level.